Hello, listeners. Welcome to our Healthcare and Healing podcast. The COVID-19 pandemic has challenged even the most robust healthcare systems across the world, leading to questions about financial resources, emergency preparedness, and personnel shortages. In Europe, responses to the COVID-19 pandemic had varied greatly. In order to investigate various European healthcare systems' response to the COVID-19 pandemic, as well as the intersection of healthcare and public policy, 6 of us undergraduate students from the University of Notre Dame participated in a research project called Healthcare and Healing. Through the Nanovic Institute for European Studies, we each chose a country in Europe that we are very passionate about and wrote a report on the country's response to the COVID-19 pandemic. This podcast will serve as a dialogue between the 6 research assistants about their respective country in order to share their knowledge they have gained over the course of this project. Our podcast will include a background on each healthcare system, the intersection between politics and healthcare, the waves of the pandemic, a discussion of centralized versus decentralized responses, and the recovery and recommendations we have for each country. Thank you for joining us on this journey, and now we will each introduce ourselves and the countries we will be discussing. Rose, would you like to start us off?
Hi there. My name is Rose, and I am an upcoming junior at Notre Dame studying neuroscience and behavior. I'm from the south side of Chicago, and for the past month, I've been studying Lithuania's healthcare system. Lithuania has a special place in my heart because my grandparents' caretaker, Virginia, from there, and I've often heard her talk of her country and her love for it. And so I wanted to learn more about Lithuania, and I've loved doing so. And I'm so excited you're joining us for the podcast.
Hi guys, I'm Dana. I'm also from Illinois, but not Chicago, the cornfield part. I'm an upcoming junior as well at Notre Dame, and I'm studying biology and international development. I've been researching Italy's healthcare system for the past month, and we'll be talking about it today. I was actually supposed to study abroad this summer in Rome, but sadly that was canceled because of COVID. So this project has been an amazing way for me to still learn about the country, even if I can't be there in person.
Hi guys, my name is Kira Murphy, and I'm also a rising junior here at Notre Dame studying finance and English. I'm from Central New Jersey, and while I'm not a STEM major like the rest of the team, I've always been fascinated by the different aspects of global healthcare policy, especially in Europe. And I ended up choosing to study Germany because it gained a lot of news coverage during the pandemic and the press for handling the pandemic, and I was really interested in learning more, so excited to chat about that today.
Hi guys, my name is Isabel Barnage, and I'm a soon-to-be senior at Notre Dame. I'm originally from Arlington, Virginia, which is just outside of Washington, D.C. At ND, I am majoring in Spanish and pre-health and minoring in international development studies like Dana. And as a Spanish major, I've always had an affinity for Spain, and Spain was the first country I traveled to outside of the United States, and I've loved travel ever since. So I'm so excited to share all I've learned about Spain's response to the COVID-19 pandemic with you guys.
Hi, I'm Molly, and I'm a rising junior here at Notre Dame. I'm studying American Studies and Studio Art, and I'm from St. Louis, Missouri. This project was an exciting opportunity to jump into a more global lens by working in European studies as well as American studies. And I specifically chose to study the United Kingdom because I was really intrigued by the way the UK and the US had so many political similarities and so many systematic differences, and wanted to take a deeper dive into that.
Hello, everyone. I'm Crystal. I'm a rising junior studying neuroscience with minors in Latino studies and theology. I'm originally from Kenosha, Wisconsin, so I'm definitely a cheesehead. And I was really interested in researching France's healthcare in response to COVID. And I chose France because, along with Italy, France was one of the epicenters for the virus on the news that we first heard about in the US, and still remains one of the countries with the highest number of COVID cases in the world. So I was really interested to dive into that, and I'm interested to talk about it with everyone. And thank you, everyone, for your introductions, and thank you, listener, for tuning in. We hope you enjoy our podcast on European healthcare and Europe's response to COVID-19, and we will see you in the next episode.